In the last section for chapter 16, we're going to talk about the diagnosis, treatment, warning, and risk signs of cancer. So, again, very brief on the learning objectives. So, we're not going to try to overload on this. We don't need to know every detail about treatment and diagnosis, but we're going to just talk about the medical management of cancer, including prevention, and identify the warning signs of potential cancer. So the diagnostic tests that they use, of course, routine screening for early detection, because the earlier it gets detected, the better chance you have of surviving it. And when routine screening is also done to detect any further tumors if somebody already has been diagnosed. Self-examination, breast, testicular, and skin examinations are important. Blood tests can measure blood cell levels during treatment if somebody's undergoing cancer treatment, or detect tumor markers, like the PSA test detects tumor markers for prostate cancer. So those should be done routinely. Routine screening also, or for diagnosis, if they suspect cancer, they might use imaging, radiographic, ultrasound, MRI, CT. All of these are methods for visualizing changes in tissues or organs. Sometimes they do a biopsy where they take a tissue or a cell sample and they do histological and cytological examination to determine what's going on with the cells, how differentiated they are, maybe tumor type. If there is a tumor, they might be tested for growth promoter sensitivities. There's some tumors that are estrogen dependent. Um, and it's the biopsy is a most dependable confirmation of malignancy. So they see something on the imaging, and now they want to do a biopsy to see what's actually going on and confirm it. So physical assessment, masses that are felt or seen during an exam. Some cancers have those and some don't. So with lymphomas, a lot of times you have a mass or something in a lymph node that is palpable, and sometimes you don't. Imaging studies, of course, radiographs, of course, laboratory tests, blood tests, CSF analysis for brain cancers, fine needle aspiration, getting little cells out of a tumor, or a tissue biopsy, which is for the definitive diagnosis. Screening tests include colonoscopies that you start getting when you're 45. Usually, if they don't find anything, they'll tell you come back in 10 years. If they find like a lot of polyps or something, they might say come back in 2 years or come back in a year. So the frequency of colonoscopy after your first one depends on what they find in the first one. The pap smear, usually it's annual up until a certain age, and then it's every 5 years after that, where they take a few little cells from your cervix. Mammography is usually um, annual to every 2 to 5 years, depending on your risk factors. So, primary treatments for cancer: surgery, chemotherapy, and radiation. So, surgery, they excise the cancerous tissue as much as possible. Chemotherapy has specialized drugs to treat, so chemo's chemical drugs. And radiation is targeted energy to kill cancer cells. There are different types of each of those things. So, other methods besides the three biggies are hormonal therapies, immunotherapy or biological therapy. And I've read a lot of stuff about immunotherapy being very effective. So, that's a good thing. Targeted therapy, where they target specific tumor cells. Sometimes with different blood cancers, you might need stem cell transplant or anti-angiogenic therapy. Precision medicine, where they like genetically design something just for that cancer cell, that's pretty rare. And then in advanced stages where treatment isn't possible, sometimes palliative care. So palliative care can be a really wide variety of things. It can be something like debulking a tumor so it's not causing as much trouble if they can't get it all the way out. But lots of options for that as well. Radiation therapy is going to kill or shrink cancer cells. It targets fast-growing cells. So it can affect your skin and epithelial cells because they're fast-growing cells. There's external, internal, and sometimes they actually put an implant into your body that emits radiation. And don't go across international borders if you have one of those, because it'll set off alarms. But the side effects of radiation can be pretty serious, like immunosuppression, fatigue, nausea, vomiting, anemia, hair loss. It's critical for PTAs to know that skin protection is crucial for these people because radiation can make the skin thin and fragile, and there's a higher risk for pressure ulcers, tears, and lacerations, and no thermal modalities for cold or hot for a year after radiation because of the damage to the skin. So, chemotherapy is specialized drugs that target cancer cells and target fast-growing cells. And often multiple drugs are used simultaneously, but it's pretty serious. And so it also affects healthy cells. And a lot of the side effects are because of that. So it can be oral, it can be intravenous, that's pretty common. It can be injection, intrathecal, where they go into the spinal fluid space, interperitoneal into the abdominal cavity, intraarterial into a specific artery, or topical on the skin. So when you're working with someone who's undergoing chemotherapy, in this picture, you see the caregiver is wearing a mask and gloves. You, especially if with topical, but even with some of the other delivery methods, you don't want to be exposed to the chemicals that are being introduced into their body. And so you have to wear a lot of PPE and you have to protect them. So the common side effects for chemo are severe fatigue, nausea and vomiting, hair loss, anemia, appetite loss, high susceptibility to infection, and sometimes lymphedema. So patients are immunocompromised, and we need to be aware of that in the clinic setting. We want to avoid exposing them to other people who might be sick. Their exercise tolerance is going to be severely limited, and so we need to progress gently. Sometimes you'll be in the hospital and you'll see somebody will have neutropenic precautions, meaning they don't have enough neutrophils to help protect them in that non-specific, and so they're pretty isolated. You have to protect them. Other treatments, immunotherapy boosts the immune system, especially the killer T cells, which are going to go out there and kill cancer cells, the cytotoxic CD8 cells. The side effects for immunotherapy can be skin changes, flu-like symptoms, or injection site irritation because the treatment is administered via injection. Stem cell transplant replaces blood-forming cells in your bone marrow. Usually, it can be autologous, where you get stem cells from a healthy area in your body. It can be a matched donor or from an umbilical cord. So the for blood cancers and sometimes post-chemo radiation recovery, stem cell transplant is used. In order to do the stem cell transplant, a lot of times they have to do radical chemotherapy to kill off the damaged stem cells and then replace them with the new ones. So it's a pretty serious treatment, but it can be a cure for leukemia. So that is a common treatment for children with leukemia, and there's a cure. So I mean that's amazing. Because 30 years ago there was a 5% survival rate for leukemia, and now there's a 95% survival rate. So that is a big, big difference. Anti angiogenic therapy, it cuts off the blood supply to tumors, so it stops the growth, but it doesn't cure. And the side effects are hypertension, high blood pressure, or potential hemorrhage. What they do is they cut off the blood supply to the tumor to stop it from growing, and then usually surgery afterwards to remove it, if possible. Targeted therapy, that's the precision medicine. It targets specific proteins in cancer cells, requires tumor analysis so they can customize it. So that's like a customized treatment for your individual cancer cells. So there are, just like everything, there are modifiable and non-modifiable risk factors. So we can control tobacco use, alcohol consumption, diet, obesity, sunlight exposure, exposure to other cancer-causing substances besides UV light. Non-modifiable, can't control the age, can't control what genes your family gives you, Can't control your family history. So let's control what we can control and not worry about what we can't, or be aware of what we can't. So, other important risk factors include chronic inflammation because you're damaging cells with that chronic inflammation, hormones, immunosuppression, infectious agents, and radiation exposure. So, 5 to 10% of cancers, so pretty small, are hereditary cancer syndromes where genetic mutations are passed from the parent to child. And there are genetic tests available for some hereditary forms. So genetic testing is becoming a more prevalent way to determine whether you have risk factors. Definitely viral connections for some cancers, HPV for cervical cancer and head and neck cancer, and hepatitis for liver cancer. There are vaccines for both of those things. Genetic inheritance accounts for only 5 to 10% of all cancers, like we said. So you inherit damaged DNA from your parents. You might also inherit certain genes that increase susceptibility to certain cancers. You also might inherit a DNA repair process that is just not quite so robust. And certain types of cancers tend to recur in family generations: breast cancer, colon cancer, ovarian cancer, uterine cancer, thyroid, and pancreas cancer. But really keep in mind that if you inherit a predisposing mutation, it doesn't mean that you're going to have cancer. It means there's an increased risk of developing cancer. So, lifestyle choices. I love to talk about this. So, there's tons of research, and I have a bunch of references at the end of the PowerPoint. So there are increased risks of cancers directly related to the following lifestyle choices. Tobacco use, no surprise there. Lung, upper respiratory tract, esophagus, larynx, bladder, and pancreatic cancers are all linked to tobacco use. Excessive alcohol use, so however you want to define that. Mouth, pharynx, larynx, esophagus, stomach, colon, rectum, liver, breast, and ovarian cancers are all linked to excessive alcohol use. Increased weight, breast, ovarian, uterine, pancreas, gallbladder, prostate, colon, and rectum, all associated, all linked to increased weight. Physical inactivity, colon cancer. Poor diet, breast, ovarian, uterine, gallbladder, pancreas, colon, rectum, and prostate cancer. So all of those things we can control, let's control them. Don't worry about the things you can't control and control the things that you can. It's my motto. So certain infectious agents, HPV and hepatitis B and C, are linked with certain cancers. HIV is linked with Kaposi sarcoma and non-Hodgkin's lymphoma and cervical cancers. Epstein-Barr is linked with certain types of lymphomas and nasopharyngeal cancer. So some of those have vaccines that go with them. Some of them have ways to reduce risk. The general warning signs: unusual bleeding or discharge anywhere in the body, change in bowel or bladder habits, change in a wart or mole or any type of change in skin appearance, sore that doesn't heal in the skin or in the mouth. So when you go for your regular dental checkup, they do cancer screenings in your mouth, which is good. Unexplained weight loss, persistent fatigue, which can be caused by anemia or low hemoglobin, but persistent fatigue, persistent cough or hoarseness without reason. Like if I'm hoarse, it's because I spent all weekend in the lab, teaching in the lab. But if you just have a persistent cough or hoarseness that doesn't have a reasonable cause, a fever with unknown cause or pain that doesn't resolve, or a solid lump anywhere on the body, basically. So refer a patient back to their physician if they have any persistent unexplained symptoms. So sometimes somebody will say, "Well, I've lost 40 pounds in the last 6 months and I haven't been doing anything." Whoa, red flag. And so what I say is, I don't say, "Gee, you might have cancer." I say, you definitely should bring that up with your doctor at your next visit, which hopefully is coming up soon. Any new onset of concerning signs or patient reports concerns about their family history. What I always recommend to people is when you go in for your regular checkup, write down your concerns and tell them to your doctor, because a lot of times if you don't write it down, you're not going to remember to tell them when you're there. So I tell people, write down your concerns, go in and tell your doctor, or even if it's not time for your regular physical, make an appointment and say, hey, I have some concerns that I want to discuss with the doctor. So, and write them down. So risk reduction, don't go in tanning booths and limit UV exposure. Regular medical and dental examinations, regular self-examination, diets, increase fiber content, reduce fat, 5 to 10 servings of fresh fruits and vegetables daily. Um, they have antioxidants which reduce changes in DNA. It's easy. We can do that. We can do those things. Cell-mediated immunity recognizes some tumor cells and destroys them. So we have those natural killer cells that go out there and get you. So if you have a strong immune system, you're more likely to catch cancer cells before they get to be problems. Immunization for cervical cancer and hepatitis is recommended to reduce risk from cancer infection. So immunization saves lives. Remember that. Continued advances in treatment of cancer and improved methods for early detection lead to improved long-term survival rates. Yay. So this is 2011. So this is still a while back. It's one of the references that's at the end of the PowerPoint. But the 5-year relative survival rate rose from 48.9% in 1975, and this is for all cancers, to 69% in 2011. Yay. In 2014, there were an estimated 14.5 million people living beyond a cancer diagnosis, and it's expected to rise to almost 19 million by 2024, and that's from the National Cancer Institute. Cancer is no longer, it was originally classified as a grave disease with no significant curative options, but it's no longer that. There are some significant options, and not everybody survived cancer, but a lot more people survive it than used to. The 5-year relative survival rates for combined cancer in all sites, for all races and both sexes, that's what is shown here. And so people are surviving cancer. So get early treatment, get the interventions that you can, because you can survive cancer. Not everybody does, but a larger proportion of people survive with good treatment. Zillions of references. The National Cancer Institute is a great resource.